was on the people. We didn't have the people then. We tried to engage all the stakeholders, finance, public service. They could not increase our wage bill. They couldn't allow us to get more people, so we had to work with the few people that we had. The expired medicines are not entirely related to the delayed deliveries. The expired medicines are a result of the medicines that may not be consumed by the health facilities for various reasons. And the reason that we have given to the Auditor General and all the stakeholders concerned is something that we are also bringing to the attention of this Committee of Parliament. That one, medicines have an expiry date, and therefore there is a likelihood that they will expire before they are used by the health facilities or before they are taken even to the health facilities. That is why internationally, that is an international standard everywhere in the world. They will tell you that if you have medicines, they give you up to 5% of the value of the medicines that you turn out in any given financial year. Meaning, if you have 100 shillings worth of medicines in the financial year, and more than 5 shillings worth of those medicines expire with you, that should concern all the stakeholders. If the expiry is less than that, that is acceptable internationally. So that is the starting point, because everybody knows that anything that has an expiry date, to some extent, you cannot project. Even if it is a supermarket, you are the owner, you cannot know how many people will come. If a health facility is there, yes, at the beginning of the financial year, they projected that we might need so many doses of Coartem. But during the financial year, if malaria cases go down, for example, now NMS and Ministry of Health and partners are distributing the mosquito nets, the cases of malaria has substantially reduced. So if you have Coartem, you cannot use that Coartem for anything else other than malaria. So you will have a situation where some of it will expire on you. So your estimate, you use the best estimate, because as NMS, all we do is to collect the orders that each individual facility has given. We communicate to them the money that Parliament has given to us on their behalf, and we ask them to tell us what, in terms of range of medicines and the quantity that they would need out of that money, and we simply aggregate that need to form an NMS procurement plan. So if along the way certain cases do not appear, and the health facilities tell us, yes, we told you we would need 1,000 doses of Coartem every cycle of 2 months, but now we do not have any cases of malaria, we do not want you to give us that Coartem, we want less than what we had projected. There is nothing much you can do with that. So to that extent, the medicines will expire. And as we get into the details, Honorable Chair and Honorable Members, you will be able to see our expiry rate as compared to the international standards, which are allowable. And it is very clear to everybody that we are one of the best warehouses, probably on the continent and beyond, that have the least rate of expiry. But we will go to the details. And our expiry then, which is 8 billion, as compared to the total value of the medicines that we had in the warehouse during that financial year, you will be able to see that it is way below the acceptable 5%. But even before, beyond the 5% that is internationally acceptable, our board of directors said, since we are a poor country, the 5% that is allowed internationally is still a high figure. So they tried to impress it upon us as management and staff to see a way of reducing that expiry rate below what is acceptable internationally. And within our working documents For us, our maximum acceptable at NMS is 2%. It's actually not 5%, which is allowed internationally. And the detail will show how we have been performing against that acceptable 5%, but also the one demanded by our documents of 2%. Honorable Chair, your other concern was we are not able to deliver the medicines, all the medicines required. Some medicines were expiring, but also we have underutilization of the vehicles as observed by the Office of Auditor General. And our response to that was that actually the medicines, the vehicles that were even at 0 mileage when they came, are the vehicles that we got as a donation, and they were specifically for distribution of vaccines. It is a donation from Gavi. The Ministry of Health, together with partners, started a process of seeing how the vaccines that NMS delivers to the district vaccine store can get closer to the health facilities. Honorable Chair and honorable members, I just wanted to give some piece of information here. For the other medicines and medical supplies that we deliver, they only go to government health facilities. But for vaccines, for the children, and the human papilloma virus, the HPV for the young girls, these vaccines go to every health facility outside of government. Meaning that if you go and find a vaccine for children in a private facility, whether it is Nakasero Hospital, or it is a PNFP, it is Rubaga, or Kivuli, or Zambia, or Mengo, that vaccine is given to them by government of Uganda. So it is beyond the government health facilities. And one of the issues that were observed by the partners were that while NMS was delivering what we call the last mile, that is, we deliver using our big vehicles up to the district stores, but we also use the smaller vehicles to move the supplies from the district to the individual facilities. For vaccines, because they are with every clinic, every hospital, every health center out there, private or PNFP or even government, we could not get all of them because of their numbers. So Ministry of Health agreed with Gavi on a project, and we started on this project in Busoga region. We have moved to Bugisu region and the regions surrounding, and we are expanding it in the near future to reach the whole country. That we start what we call the vaccine last mile delivery, because the other one, the last mile delivery was for the other medicines. So now we have started the one for vaccines. We are not taking it to each and every health facility, Honorable Chair and honorable members, but we are bringing it closer to what they call a health sub-district. The districts identified health facilities that are closer. They are closer to the individual health facilities than the district, because we realize that all those health facilities, clinics, hospitals could not move to the district to pick their vaccines. So the request was that we move these vaccines a little closer to them, what they call the health sub-district. So they would identify a health center 3, and the Ministry of Health and partners equipped it with bigger fridges to receive these vaccines. So we still deliver using our bigger vehicles to the district, but we use now these vehicles which were given to us that the Auditor General came and found they had not moved because the project hadn't been flagged off, to move the vaccines because they are cold chain. They are Land Cruisers, fully cold chain. You cannot put any other medicines unless if you remove the fridges. To now move these vaccines from the district to the lower facility, which is a health sub-district, which is closer to the other facilities which can pick. Because it was realized that mothers would deliver, but they would find that there are no vaccines in the health facilities where they deliver from, private or government. And the reason was that the people within those health facilities would not have the resources, the vehicles, the fuel to go to the district to pick the vaccine. So the intention was to bring the vaccines closer to them, and by the time the Auditor General came, these vehicles had just been brought. I think they were there for almost a year, but we do not have the fuel and the personnel to move them out of NMS. We have since received the money for this pilot, both the fuel, and we are using our own drivers, and now we have started piloting. I believe that when the Auditor General now comes, they will find that these vehicles have no longer at 0 mileage. They have moved. There were 22 of them. Probably the ones that they delivered, I think, about 2 weeks ago, those ones they may find they have not moved a long distance. So, Mr. Chairman and honorable members, that is the brief that I can make on the issues that you've raised. Thank you.
Thank you. Be on the record. Are you saying that among the expired medicine that the Auditor General quotes totaling to 80 billion, there are no vaccines?
I do not know the detail of each and every medicine, but I believe that you would not find any sizable quantity of vaccine.
No. The question is, I'm out of the 8 billion worth of medicine that expired before delivery. Are you on record saying this cost doesn't include any reference to vaccines? Is there someone in charge of the stores? How was it quantified?
Yes.
You can assign any of your staff who is directly responsible.
Yes, Mr. Chairman, let me first say this, and then I'll ask our person who is in charge of the stores to say. I would like to be on record to say that for these childhood vaccines, there would not be any of those vaccines that would be part of what expired. If there is any vaccine, it is probably the remainder of the COVID vaccine which we had, because COVID is the one that caused us a lot of problems then.
And you said these vehicles were donations for specifically which medicine?
They were specifically for vaccines, to take the vaccines for
which vaccines?
Those childhood immunizable, the polio, the BCG, the measles, and others. The general vaccines that we find.
Was there a restriction that you cannot use the available vehicles to deliver medicine? Was there any restriction on the use of vehicle? No. You said these vehicles, which are were packed at 0 mileage.
Yes.
Were for a project. Now, while donating those vehicles, were there conditions tagged on them? And can you prove to the committee that you could not use the available vehicles?
Honorable Chair, what I said about these vehicles was that these are called chain vehicles. These are vehicles which are fitted with fridges. I am not going to use a vehicle which is fitted with a fridge to take Panadol, to take Coartem, to take anything. There is no space for them within the vehicle. Number two is
so you are saying these vehicles cited by the Auditor General could not carry this medication?
No, they are not for the regular medication. But even if, Mr. Chairman, even if they were, the challenge was that we didn't even have the staff. So the bigger challenge of the late delivery, as I had said earlier, was that we did not have the staff to move, to pack these medicines, pick them, because we had not been given the wage bill. So we could not recruit more staff to deal with the additional resources that Parliament had given us.
And was this medicine finally delivered?
Yes, Honorable.
I'm saying it was worth 196.9 billion.
Yes, Honorable Chair, it was finally delivered. That's why I said that I do not expect that value to be seen in the audit report that this committee will review at the end of, for the last financial year.
Do you have a transport department?
Yes, we do.
Where is it?
It is under the stores and operations. It's under.
Yeah, let's get him on record, the one for stores.
Yes, Chair.
The Auditor General raises a critical concern that whereas people in the country need medicine, it expired in your stores due to non-delivery and it is worth billions of money. You are in charge of the stores. What's the procedure of receiving and delivery? And could you account for the delay? Because away from the fact that you had vehicles, but still by the time you receive medication, there is an established mechanism of delivery countrywide. So give us a chronology, how medicine expired in the stores when you are the transport, you are the one in charge of transport.
Okay, just a bit for context.
Away from the scientific explanation the general manager gave, that which is
also wrong, Chair, because, Chair, we are a very, very poor country. So even when you look at the 2% approved by the board, we are still way below, because you are looking at 8 billion as it's just a small thing. When Ugandans are suffering, do you know how people are suffering? When you go to health centers, there is no issue drugs. People go to the pharmacies to buy using their own money. And yet we have things that are expiring in national medical stores. So to me, even the 2% that they are talking about, it is still very big.
Yes, Honorable Bruce.
Thank you, Chair. Chair, I don't know procedurally if we are in good shape, because the national medical stores is a beneficiary of appropriation. I hope that's correct, Mr. Director. And that would mean that their budget performance report would align with the format presented by the Accountant General, which requires them to show us the initial budget, the revised budget, and any deviations, if any, but also to show us a statement of appropriation, which would ordinarily confirm the money allocated by this Parliament. In the event that we don't have that, Mr. Chair, we are not very sure whether we are dealing with the actual statement. Because if they are talking about revised from what? Because our foundation and basis is in what we are allocated. And any deviation from what we are allocated requires some minimum regulation provided for in the rules of Uganda. Now, without that base, we cannot discuss properly. We cannot understand properly the reallocations or the revisions, because we don't know the base, Chair.
Yes, well, our technical team will look into and establish additional information, because we have the Auditor General's team attached to the committee. But away from the fact, the available audit report, on the face of it, has observations by the Auditor General. We are trying to preempt a better understanding of the entity, given the highlighted issues. Because the Auditor General highlighted these as critical concerns. And away from the Auditor General, even if you are not ordinary Ugandan, to hear that drugs worth 196 billion delayed in delivery at the stores of National Medical Store. Also to hear, as an ordinary Ugandan, that drugs worth 80 billion expired in stores. So meaning, away from the 80 billion, they must have also spent on destroying this same expired drug.
And Chair,
now, I'm also hearing that the same National Medical Store, which never delivered on time, and drugs expired in their own stores, has packed vehicles at 0 mileage. Now, these are critical areas of interrogation, even before we go into the other aspects. And as we try to understand, I want us to first hear from their transport pass officer before I open up here. let him first be on record, the one in charge of transport.
Okay, thank you very much, Chair. I'll start with the issue of the parked vehicles, just to appreciate what is going on here. So, first off, as the General Manager explained, we distribute vaccines across the country, and some of these commodities go to public facilities, and some of them go to the private facilities. The current arrangement we have with the Ministry of Health is that we will convey vaccines from the central store, which is at NMS, to the districts. And then the districts are responsible for the distribution of that vaccine from their DVS, which is the district vaccine store, down to the individual health facilities. So our collaboration with Gavi, UNICEF, and the Ministry of Health UNEPI program was to support the districts to improve the means by which they convey the vaccines from the district vaccine stores down to the individual health facilities. It did not stop us from continuing to move the vaccine from NMS to the districts. So that project required resources, fuel as the General Manager said, and also personnel to drive the vehicles down to those individual facilities. These Land Cruisers, which were donated by Gavi, are specifically designed to carry cold chain commodities. They do not carry any other items. We can take mama kits in them. We do not convey dust bins in them. We cannot take gumboots in them. They are only specific for vaccines. So now that we received resources from Gavi, they've supported us with additional funding to make sure that they can facilitate the transportation down. That is to cover fuel and maintenance of those vehicles, which was not provided for in that financial year. We are now able to do that. And just as the General Manager said, we now have the budget to actually get the staff to drive the vehicles and take the resources down. We're able to start utilizing those vehicles. So the delay is not contingent on us not using the vehicles. It was completely for process improvement on how we move vaccines from the districts down to the individual health facilities.
So the stores at the districts are also under national medical stores?
No, they are not. I was just only explaining how we move the
Auditor
vaccines.
General must have audited medicine in stores of national medical stores.
Chair, just for clarity, I've just been explaining the issue of the vehicles and why they were parked.
And to be quick on this, among the expired medicine, were there no vaccines?
No, this is not related to vaccines at all.
There
The
are no
vaccines delivery has gone on very well, and we've been able to fill all the orders that we have received.
Could you have any documentation as regards this expired medicine as of 2024, 2025?
I can give you a brief summary of what expired.
Not the words in a record of the medicine.
The auditors who looked at it definitely have
No.
full
This is the
detail.
committee.
Yes.
We want to look at the list. How do you register?
If
the
provided,
medicine?
that can be provided.
Yes, we want to
It
look
is
at
available.
what medicine is referred to by the Auditor General.
Yes.
But because it must exist as medicine before quantification.
Yes.
How did you, what were the mechanisms of transporting this medication over the years?
The essential medicines of the
Yes.
category that expired?
Yes.
Okay, just for us also to appreciate the range of medicines which have expired here, is that 95% of the commodities which are under this category, the 8 billion, are items which have been donated to the government of Uganda through the Ministry of Health. Only 5% have been funded by government. So the reality
So
here
in the
is,
list you will provide the committee, you'll indicate which items were donated and what particular items were procured by government of Uganda.
absolutely correct.
Proceed.
So for us to appreciate this a little bit better, at the beginning of every year, the Client Services Department works with every health facility in the country to try and quantify exactly what they shall need for their needs for an entire year. We also work with the Ministry of Health, who do the planning for the different programs that we have in the country. That may be the vaccine program, the HIV program, the malaria program, TB program. They also quantify and work with development partners to see exactly what they think the country shall need for an entire year. Now, sometimes in the execution of our deliveries, that demand may not materialize. So there is effort put into trying to quantify.
Don't just assure, don't be in assumptions. I'm referring to 2024.
Yes.
2025.
Yes.
Are you trying to justify that the medicine you had in store was not needed by the medical facilities?
The only way it can expire is if we do not receive orders for it from health
So you
facilities.
never received the orders?
Yes, so
for
there
the
is no
medicine.
demand. So the only way it can expire is if it is not in demand. As simple as that.
So medicine expired because medical facilities didn't requisition.
That is correct.
Can that be true?
Thank you, Chair. NMS has the nexus between the under delivery and then the packed vehicles. The little knowledge I know about donations is that you, the recipient, you somehow guide the donor on what you need, the essentials. So if you comfortably requested for Land Rovers and Land Cruisers, then the donor complied. Yet, we needed machines or vehicles which would deliver these medicines wherever they were supposed to be delivered. Secondly, you as NMS, if an unhealthy facility, for example, whatever, in their projection, they have requested for X, Y, Z, and you've delivered either half or full or something of that sort. When that delivery is fully complied with and there is still demand, do you still go by the so many bureaucratic tendencies of let this medicine expire, yet the demand is still there? Because we are speaking on behalf of the people. They are the very people who are complaining that they are dying of different diseases simply because the medicines have not been delivered. And you are telling us that the very people who are complaining did not requisition for the medicine. So for you, you sat in your comfort zones and said, okay, since they've not requisitioned, don't you hear what we hear?
Yes.
Thank you.
Yes.
Okay. Thank you, Mr. Chairman. I want to dispute two facts that have been presented. One, from the general manager, when he said that one of the reasons why medicine is expiring is because they are unable to project consumption. Now, I'm happy the finance person is here. You know, we have what we call economic order quantity. I think you have heard of such a statement, economic order quantity. What it means is this is the quantity that a company can hold to minimize stock holding costs and the cost of frequent importation. Now, one of the costs of stock holding is the expiration. When you get those drugs expiring, that's the cost to the business. Now, there are models, because you have been in business for a long time. By now, you have enough data to help you predict with fair accuracy the consumption that you need annually. If you don't know that, the experts who can help you so that you don't just buy stock. I've already even done calculations. We have what we call stock holding days for your company. Currently, it is like 5 months. Meaning, on average, you hold your stock for 5 months before it goes out. You can calculate. You get your average stock for the year. You divide by cost of sales times 365. You get 5 months. So that is not correct. Then there is the issue where I said there were no orders. That's why the medicine got expired. When you go to the balance sheet, there's what we call deferred income. Well, deferred income means someone has given you money for a service, but you have not yet delivered, so you cannot recognize that income, not until you deliver the service. The fact that you have deferred income of 205 billion, actually it is double the previous year's balance of 107 billion. It means people had paid you to deliver, but you did not recognize that as income because you had not yet delivered the what? The medicine. So, why would someone pay you when he doesn't need the medicine? Thank you.
Thank you. Yes, Honorable Kim.
Mr. Chairman, first of all, I'm so dissatisfied by the arguments made by the director of National Medical Stores. Many of us, we are living with people, ordinary people there, and we know how they suffer. For sure, there is no type of medicine which cannot be consumed by the public. Looking at the range of the diseases out there, can the general manager, I don't know whether the titles are right, the way I'm stating them, can the general manager tell us the exact type of medicine
the exact type of medicine that expired so that we can ascertain whether that medicine was not required by the public. Number two, the issue of asking for a supplementary, and you don't use that money, and you come here, then you claim or you say that the parliament did not approve or increase the wage bill. I want to understand, do you plan after receiving the money or you plan before receiving the money? If you knew that you had not yet attained full approvals, including even that increase of the wage bill, why did you ask for that supplementary?
Thank you.
Mr. Chair, there is one other issue which is remaining.
Try to summarize.
Then, about the bad debt, can we get to know the exact institutions which did not pay that money which you wrote off as a bad debt? Because you said that money which was pending, the 16.44 billion shilling, that some of that amount you wrote it off as a bad debt. Can we get to understand the exact institutions, organization or individuals who did not pay that money and why, so that you made you write off that money? Thank you very much.
And a copy of that parliamentary approval.
Yes. A copy of the
Thank you. Yes, Honorable.
For the write-off.
Yes, Honorable. Honorable Kim, you can switch off.
I wanted maybe to consult the team or our witnesses. Do you consider the World Health Organization protocol while procuring drugs in case of any change? Then second, members have been mentioning about these drugs. We want to know the exact names of drugs that expired, their quantity and the date of expiry. Then lastly, when you're supplying these drugs, do you also consult with the district health officers? Do they submit to you before you supply, or you keep waiting for those who are coming to ask from you? Thank you.
Thank you. Yes, Honorable.
MD, in your response to the expired drugs, you stated that you did not have enough people to process for deliveries. I don't know which people are those. Then you said sometimes you deliver supplies to private health facilities. Now this is done at the expense of public, especially up-country health centers. They don't have, but you also have some percentage to private facilities who remain charging. Do you have a memorandum with them that when you deliver to you at zero cost, you will also not charge, or you will charge something less? You mentioned about accepted expiry level, that now it is lowered at 5%, I think maybe according to international standards. You as 2%. You who lives in Uganda, do you think really you should see medicine expiring in stores to follow the expiry level? Thank you.
Thank you. Yes, Honorable.
Habiara, fortunate again. To the MD, have you gotten the money to procure the drugs? Before procuring the drugs, you must have realized that you don't have the manpower to process the packing and delivery. And you should have projected that one. Why did you go ahead and procure the drugs when you knew you didn't have the manpower to process them? Two, if the drugs were in the stores, I am sure the accountant might be knowing or might have been paid overtime to some staff who are even secretaries or sweepers in the organization to do some extra work. Was it hard to get the drivers, because the trucks are there, give them overtime
and they deliver those drugs to wherever they're supposed to go. 3, some districts are there lacking the drugs and they have transport. If you ever told them that you have drugs here, but you do not have trucks to deliver them, I am sure they would come and pick those drugs to save another life of a Ugandan who needed those drugs. So we could have, not could, because even the report you are saying some people died because these drugs never reached them. Are we fair to the ordinary Ugandan?
Thank you. And as you respond, it's not a question of fairness. It is a question of accountability. For the colleague who asked about the type of medicine, we have instructed and directed that a very list, detailed, because possibly the drugs are too many and of a variety. A list of those drugs. Equally, when it comes to your responses, you are now here to account, because the Auditor General, after auditing national medical stores, from his findings, you delayed to deliver the medicine. I would really expect that you give us a technical reason, a technical answer that occasioned the delay to deliver the medicine. By saying you act on requisitions, it is also understandable. But in circumstances that there's a lot of public outcry for medicine in hospitals, are you saying that the medical facilities fail to requisition for the drugs and you have nothing to do? And if that is the case, what option is available? How can we proceed? What is the best way to approach it? Do we need to now revisit or someone, the Minister of Health and all directors of medical facilities? What is, in your opinion, what must be done to ensure if the delay is occasioned by failure to requisition, then what is the solution you are fronting? So you must equally be objective in terms of what should be done, not only coming to appear and the subsequent financial year, other billions of money is wasted in expired medicine. And when it comes to the delivery, I don't think National Medical Store started in 2024. It has been there. We want to learn that when the medicine is in your stores and you identify that the expiry period is on this date or this particular date, don't you have internal checks and mechanism to ensure that medicine is not, you don't wait for medicine to expire? That upon checking and you realize that the validity of that particular drug, you devise means of ensuring that it's consumed and delivered for consumption before expiry. So we really need to hear the technical reasons within the National Medical Store, not just acting as a taxi driver. If you don't stay there, he will drive you up to where the taxi ends. You are in charge of essential medicine. So please respond objectively.
Yes, Mr. Chairman, in line with what you have said, I want to understand the role of internal auditor, because part of the role of internal audit is to review reports on maybe medicine which is about to expire and then take corrective action. So we want to understand, do you have first of all an internal control manual which describes the operations of stock holding, how you manage stock as an organization? They do your work, you'll be monitoring whether they are complying with the stock manual. Okay, so if you have a stock manual, please give us a copy, and also give us a report if you have ever done a report about stock in your organization during that financial year. So that is the role of internal audit.
So now please respond with technical reasons and solutions going forward, because who knows that even now there might be drugs expiring under your watch. So as you respond, be practical and also assist us with possible solutions you want to deploy.
On behalf of NMS, understand where the members are coming from with these concerns. And we are also Ugandans. We are not people who are hired from elsewhere. We are Ugandans, and we are part of the people who benefit from these services. And that is why I wanted to make one point clear, that the discourse seems to want to say that the expired, I think that is what we did not put out clear at the beginning. That if you look at the bulk of the expired medicines that are here, that now are the concern, the 8 billion that we are talking about, I can confirm, and I'm on record, that you'll find that more than 90% of the medicines that expired would not be the medicines which the patients would have needed at that particular time. Why? One, I am saying that part of this, and there was even a big expire, I think, in the previous year, part of this was the tail end of the COVID vaccines, which Ugandans had said they didn't need. That's part of the component. The second one, and it ties in with what the Honorable Member was talking about with the WHO regimen and protocols. That is actually our biggest challenge as NMS. And we have brought it to this committee severally. We have brought it to the attention of Health Committee, we have brought it to the attention of Auditor General, and brought it to the attention of this committee. That you have especially these, what we call, they may not be new, but many of these public health concerns and the diseases like HIV and TB, and sometimes malaria. But HIV and TB are very common. They are new drugs that keep coming up every after 2 or 3 years. So they would have donated to you either through Global Fund mechanism or through, in the past it used to be USAID, they would also contribute medicines. They have brought into the country a certain type of ARVs, for example. After 1 year, 2 years, that regimen is outdated. They say that the patients no longer respond. So the HIV patients no longer respond to this type of ARVs. So they have to change, WHO changes the protocol of treatment for ARV patients for certain disease, certain ailments or certain stages of HIV, and you have to buy or you have to receive now from the donors a new type of HIV medicine, a new type of TB medicines. We all know, if we have been following, that there are certain medicines that we grew up knowing for TB treatment, for HIV treatment, which now cannot be taken by any of the patients. If you gave them to any patient who has TB or HIV, they would simply not take them because WHO and subsequently the Ministry of Health, the different governments say this medicine is no longer used. So what do you do with that medicine, Honorable Chair and Honorable Members? It cannot be used for anything else. So our recommendation, because Honorable Chair, you asked for our recommendation, and we have done this several, is that.
But before you make the recommendation, you sounded a bit academic and theoretical, unless you are confirming that the medicine that expired is actually the one you are describing, subject to provision of the list as instructed. In that way, you can now proceed to recommend on them. Otherwise, it requires us to understand the type of drugs that expired. The explanation you are offering is understandable. But needless to say, we also need scientific and acceptable evidence that actually there were no requisition or there was no need for medicine in line with HIV and the related diseases you have quoted, and that that particular medicine, there is a proof that it had been overtaken by a new medicine. Not the rhetoric,
Chair.
because now it will be very concerning to a patient out there who was expecting the medicine, hearing that actually, according to a national medical store, you could not deliver the medicine because of those cited reasons. I believe that must be after communication from one, the Minister of Health, and the other user departments. Do you have communications to that effect, or it is just an internal observation?
Chair.
Thank you. You are coming in. Do you have communications from the Minister of Health to that effect?
Honorable Chair, we have communication from the Minister of Health, not only to us, but also to the health facilities, saying these types of medicines are no longer being used for treatment of these diseases. And as a result of that, we could not give them.
Chair,
we can't make orders. They no longer make orders against
Chair, if we are to run away from the statement by the Auditor General that there is financial loss in that regard, would be for the Director and his team to prove, because change of medicine does not occur overnight. It's a process, a very long process that is extremely scientific. So it would be our requirement, Chair, through you, to prove that by the time these medicines expired, they had done sufficient supply across the country, and there was no entity in the country that was under-supplied or had no supplies at all, and that the destruction is occasioned by a scientific process leading to the irrelevance of this medicine. In the absence of that, Chair, we have no alternative but to hold the national medical stores accountable to the loss of finances in the expired medicine and the loss of finances in the destruction of that very medicine.
Yes, Honorable.
Chair, I also want to understand from the witnesses what informs or guides the donor's decision to give Uganda the drugs. Do you seek for it? Do you request them to do that for you people, or it is forced on you based on what they want to give out, so that we don't blame you for what you didn't cause? Is there a guide? Did you request for them, or they just used Uganda as a dumping ground? Thank you.
A dumping ground, yes.
I want to draw your attention to the finding of the Auditor General on page 9 and 10 of the audit report. The 8.0440 billion made up of government of Uganda stock worth 0.532 billion, and stock from development partners worth 7.507 billion formed part of the drugs that expired in the stores. So there's a breakdown. The government of Uganda stock was worth 0.532 billion. From development partners, the 7.507 billion. And on page 10, the Auditor General states that expiry of medicine defeats the purpose for which the medicine were procured and leads to financial loss to government. Now, we are interrogating this aspect in line with the observation of the Auditor General that there was a financial loss to government unless we have a fair and a convincing account of how these drugs expired in the stores. From the language of the finding of the Auditor General, the national medical store occasioned and caused government of Uganda a financial loss. And the Auditor General continues that in addition to the expiries, government has to incur a cost, to incur additional charges to destroy the medicine. And in the financial year in issue, and which was audited, that national medical store spent another 3.685 billion on destruction of expired medicine. So it's not a question of now the loss of expired medicine, even the cost of destruction of this medicine. So with this, the present interrogation, now that the Auditor General is imputing a possible cause of a financial loss to government, please give this concern the due attention it requires in your response. And the Auditor General, in his recommendation, advised that you have a comprehensive review of the systems of procurement, receipt, and distribution of essential medicine. So, as you attempt to attend to these arising concerns, be mindful that we are interrogating a financial loss. And if not well accounted for, then we have to identify who amongst you or all caused the government of Uganda this particular financial loss. So I think now this invites you to now a more technical and convincing response. You're on the floor.
Thank you, Honorable Chair. And that is what we are trying to make, the presentation we are trying to make to this committee, and we hope you'll find it convincing. One is that, again, having brought the breakdown is putting more light on what the honorable members are asking here. You have 8-point-something billion expired, 7-point-something of that is from the partners. Those are the donors. And the one of government of Uganda is about 0.5 of a billion. And that is exactly the point that we are making here. That the bigger part of the expiries, the bigger proportion of the expiries that we have at NMS is as a result of the medicines that we receive on behalf of the Ministry of Health. Because the committee members, the honorable members here, I think will believe that it is NMS which goes ahead to requisition for these medicines. The process of requisitioning for these medicines and quantifying them and ordering for them is not with NMS. It is with the Ministry of Health. They are the ones that sign these agreements with the donors. They are the ones who quantify the need, the estimated need, using the formulas and the figures that they know best. NMS simply receives the medicines on behalf of the Ministry of Health, because we are the people, we are the warehouse that keeps the medicines, and on instruction of the Ministry of Health, through either the health facilities or directly written direct from the Ministry of Health, we deliver these medicines to the health facilities or whichever other place they want us to deliver. So I would want the issue to be understood from that point, that it is not NMS that should be blamed for quantifying whether we are the people who ask for these medicines. Maybe we don't understand what we are asking for. Why have you asked for these medicines if you knew you didn't? We are not the ones who asked for them. But as the stewards of government of Uganda, once government has a donation, like now we have Ebola, people are coming, different countries are coming and donating supplies to the Ministry of Health. The people who keep them is NMS. So if Ebola tomorrow,
maybe for clear record, if I had right, the Minister of Health declared Uganda Ebola free. Validate your submission in line with the Minister of Health position as of now.
As of now, we have the supplies that are related to Ebola.
Yeah, distinguished supply from having.
Yes, we received from donors, from some of them bought by government of Uganda for Ebola.
So when you refer to Ebola, you refer to Ebola medicine,
yes,
not the
Ebola-related medicines and supplies, because it is not only the medicines, they are PPEs. We all consider them as medicines because the medicines and health supplies.
The world out there may think that according to National Medical Store, we have a disease.
Yes. So now
the Minister of Health has since pronounced that Uganda is Ebola free.
No, what I was trying to say is, when we had this Ebola, Ministry of Health mobilized its partners. Government put in money to make sure that they buy the supplies that are supposed to deal with the cases of Ebola. Now they have declared the country Ebola free. And assuming, and we are still praying that it remains as such for the next 1, 2, 3 years and beyond, what will we do with this if we had an Ebola vaccine with us? There's nothing you can do.
I think you concentrate on the vaccine.
Yes.
you had in 2024,
Yes.
2025, within that financial year.
Yes, that's why I was saying.
We don't have to stretch you to the future.
The one we are talking about, that's why I said that part of the items that we had that expired then was the Ebola, was the COVID vaccine. Part of them, actually majority of them, were the protective, the PPEs, the personal protective equipment and lab supplies for Ebola related, the test kits for Ebola, rather for COVID, sorry, the personal protective equipment for COVID and related things. These were huge quantities, these were expensive items. When COVID goes, the demand, even here, Mr. Chairman, Honorable Chair, and Honorable Members, everybody during COVID was supposed to be putting on a face mask. If you look at the quantities of the face masks that we had for our health workers, because nobody will go to a health facility without a face mask, all of a sudden, nobody, you wake up and they say there's no COVID and there's no health worker and there's no Ugandan who wants to put on a face mask. These face masks have an expiry date. What do you do with them? You keep them until when they expire. You cannot give somebody, you say you want one mask, I'm going to give you 10 because the 10 people who wanted to use them now are no longer using them. So we have that challenge. Honorable Chair and Honorable Members,
we are disturbed because over the media, we could see hospitals struggling, the medical personnel struggling to get such equipments for use, and you are, as if you want to say that they were not required, they were not needed, they were not requisitioned. Who must have requisitioned for you to deliver?
Just to recap Honorable Naki's statement, he says you have a fully-fledged department of audit, and the audit does not only audit money received and spent, but it also audits the stock. So as you audit the stock, certainly you will be seeing that drug X or drug Y is about to expire, and this is the same drug which was requested for by Hospital X. Probably they requested for 2 cartons, and the rest are expiring. Don't you have that as we audit, since these are about to expire, and Hospital X was given 2 cartons, but instead of it expiring from here, because you said you are a Ugandan, and we believe that. Don't you see our cry from our people? Do you think we are stating these things from Mars or planet Jupiter?
But I think to guide on this, we don't want to discuss and debate it in anticipation. Avail the details of these particular drugs.
Yes.
Then we can now discuss the aspect of whether it was within the understanding of your explanation with the certainty of the drug. Because here you are trying to add them together, that they refer to this medication.
Chair,
we need to unpack.
Chair, alongside the origin,
medication.
Chair, supplement?
Yes.
Chair, to augment yours, they expired on the line of who ordered for that drug should also be included in what they submit.
Chair, maybe in addition, he indicates that some of these medicines, for them they receive donations, and there is instruction from Ministry of Health, receive maybe these medicines. Their work is to store. So if these are donations, whose responsibility is it to ascertain the safe life of the medicines? Because they might be donating to you something you are clearly seeing, it probably maybe has a year to expire, and it is going to load a burden on you of destruction just in case it expires before usage. So whose responsibility is it to ascertain the safe life of these medicines?
And I think the whole argument of whether a part is a donation or a part was bought, it ends with one conclusion. It has a financial implication.
Yes.
So the question of whether what part of it was a donation, it doesn't apply. What matters, it is medicine and has a financial implication. We only want to understand the circumstances under which it expired. We appreciate that scientifically, medicine has an expiry as you submitted. But now that this has become an audit query on financial loss, a possible financial loss.
Chair, there is an attempt by the director to indicate that he's just a store. That's why it is important for us to know where the medicine came from, who requisitioned for it to come into the country, because in the event that there is also medicine they asked for, which is also costing us money in destruction, then we need to look at it in that context, Chair, as well.
But I also want to dispute something. You see, you have said you are just a store. You receive the medicine on behalf of government, you keep, and they are the ones who know the quantities. Why is it that in 2024, you wrote off the amount through your books of accounts, if it was not your stock? Because when you check 2024, you will find a very big write-down of about 300-something billion as written off stock, which was written through the books of NMS. So
I think on this subject, let's move this way. I think we shall first receive the itemized drugs so that we have a constructive discussion for a better appreciation or as to the nature of your explanation. And the Otagen already itemized what was from donors and what was from your own procurements. Then we also want to create an elaborate explanation on the requisition chronology for 2024, 2025. Let's concentrate on that financial year, 2024, 2025. We want to be certain that all, which requisitions existed or you received, and whether you delivered on those requisitions, and whether they were not touching those particular medication. I think there we shall move chronologically and appreciate possibly your explanation, but as well also raise substantive concerns. So when you're delivering that, tomorrow?
Honorable Chair, we can deliver it tomorrow, by close of business tomorrow.
I want to invite your team and honorable colleagues to the other behind table at random as we proceed. The other table in the corner, but as we proceed. So for this particular issue, I want us to move away for now, and now go to your responses and go to your respective responses over the Otagen's report. And then after them, we shall have a detailed engagement. Then we go to the financials.
Operation of all other stakeholders that we have brought around this area, Minister of Finance, Minister of Health, the Minister of ICT, we hope that we'll get there. 3.4 on page 15 of our responses. It was a commendation, and Honorable Chair, you don't think I'll go to that. 3.5, performance of non-tax revenue, where the Auditor General raised the issue that we collected only 95.6% of what we had budgeted, and he was advising that we revise our estimates going forward so that we do not project more than what we can collect. That is what we have done, and I think would like to note that Finance insisted that if NNT has not collected 100% of what they promised to collect, they will now not give you a higher target. So if now you project that you are going to collect more, they will say no. First, show us that you could collect 100% of the previous areas. 3.6 was also a commendation on utilization of warrants on page 16. 3.7, Honorable Chair, implementation of the planned activities. We also gave our responses. The major one then was on hepatitis B, where we had not procured and distributed the doses as forecasted, and we were able to explain to the Auditor General that that was beyond us because there was a global shortage of hepatitis B, and all the entire world was getting from the limited resources and limited sources. In the last financial year, we had set we set aside funds for co-financing of adult formulation of hepatitis B, and this time we were able to procure according to our plan. And we, on page 17, we put a breakdown of what we intend to procure, what we procured actually, and what was coming from the donors through Gavi and UNICEF. 3.8 was on the timeliness of submission of performance reports, which is provided for under the Treasury instructions. And our explanation was that the performance reports are submitted to Ministry of Finance through the PBS system reporting tool. However, before you make the final submission, these reports have to be uploaded from IFMS by the PBS team at Ministry of Finance. And if they have not done their work, you as an accounting officer, you cannot actually upload. And we were able to inform the Auditor General to help all the entities, because all the MDAs are facing the same challenge of timeliness. If we have to follow the timelines given to us, then the finance team must be able to upload these reports into their system so that we can complete the work as MDAs. So it is an issue that we would like Parliament to help us with for follow-up. On 3.9, Honorable Chair, that's where we had the major issue of the vehicles, but we also had another issue of the washing machine, and we are able now to confirm that we have now been able to functionalize that washing machine and dryer for the uniforms for the staff who are working within our warehouse. That is page 19. The 6 vehicles which we have not disposed of, Honorable Chair, we still have that challenge of disposal, and we have been able to bring it to the attention of PPDA. We have brought it to the attention of PSST, and we hope that we'll bring it again to the attention of Auditor General. Honorable Chair, Parliament needs to interest itself in this matter for all the MDAs. That most of the vehicles that are rotting in our yards are rotting not because the accounting officers or the entities have refused or have failed to dispose them of. It is because before the disposal, as part of the law, you must get a value given by the chief government valuer. There is only one chief government valuer. And what we have advised was that just the way Auditor General does the work, because Auditor General may not be able to go to every entity in government to do the auditing, but they pre-qualify other qualified auditors to help them in this work. So we are advising, why is it that must be the chief valuer, government valuer, as an office with a very small team to go to the whole country and do it? They can't do it, and they have failed over the years. So we have advised that Parliament prevails over this office to be able to accredit their valuers, to be able to accredit these valuers, because once the value is given, the process of procurement starts and is concluded within 2-3 months. Most of these vehicles have, and other assets have lost value because we are not able to get the chief mechanical valuer, give us this one, and also the chief mechanical engineer to come and do the work. So we hope that this one moving forward will happen, but as we speak now, when the Auditor General comes, you will find that that position has not changed. On the solar system and the batteries, we have initiated the procurement, and we believe that we should be able to conclude it. It is at the point of clearing the contract by the Attorney General's office or Solicitor General's office, and we should be able to get that battery. And on page 21 under 3.10, Honorable Chair, it is the issue that we talked about, the vehicles that were lying in our compound on 0 mileage. We have since moved on them, and we have been able to utilize all of them. And the pilot has moved from Busoga, and we have extended it to Teso and the Bukedi region, and we believe that in this financial year, we'll be able to move to the other regions of the country. Page 26 is the findings on the value for money audit, which it was performed by the Auditor General some time back in 2016, and they were following up on their recommendations. And Mr. Chairman, we indicated that we have made substantial progress in implementing the recommendations that were given to us by the Auditor General. And 4.2 is on the audit of the Treasury Memorandum, where the Auditor General gave us recommendations, and we undertake to implement all the recommendations that were given to us by the Parliament, because the Treasury Memorandum comes to Parliament, but Auditor General was implementing on behalf of Parliament how far we had implemented those recommendations. And we are implementing them as recommended by Parliament and as audited by the Office of Auditor General. I thank you very much, Honorable Chair and Honorable Members.
Thank you. Let's have the reaction on the Auditor General, on the audit report before we open into the financials. But quickly, before I open up from the Auditor General's report, I want to buttress this aspect of of utilization of assets. On page 14, you know, the figures are alarming, that during the review of the asset register, the Auditor General noted that assets worth 4.432 billion are either idle or underutilized. When you go to page 15, the Auditor General, after the photographs, states that the non-utilization of these current assets defeat the purpose for which the assets were procured and exposes them to rapid deterioration and loss of value. I want to proceed now to page 16, where the Auditor General, in the second paragraph, goes vehicle by vehicle. And I want you to itemize for us which of these vehicles were actually part of the consignment you described as a donation for a specific vaccine or drug. The Auditor General talks of 20 Land Cruisers. 20 Land Cruisers owned by the National Medical Store and used for last mile deliveries. 6 Land Cruisers worth 0.946 billion were not used during the financial year under review, since these vehicles had 0 mileage. Similarly, an additional 5 Land Cruisers made less than 10 trips, road trips, in the whole year, and their mileage was less than 10,000 kilometers, hence underutilization. Aware that Uganda and this wider coverage. So the Auditor General came down to give the details of these vehicles. Could you now turn to this table and tell us how many of these vehicles form the consignment you said were for a particular medication? Then we discuss the rest.
Honorable Chair, 100% of those vehicles on the table. All of them.
All of them.
All of them were
up to
donated.
20.
All of them.
I think we shall need to inspect these vehicles so that we are certain. But as well, did our CID attend, because they have a specialized department which can give us a better report. Do you have any officer from CID? Our CID. Get a microphone. If we are thinking of ascertaining the usage of these vehicles and specifically the model, the make, and what they are used, they are made for. Is your team competent to do for us that inspection?
It can be given by the, I think by the IOV and other branches, I think.
So you can work hand in hand and visit National Medical Store parking, whatever they are, and give us that assessment?
Yes, Chair.
Yeah, so let's, our CID, in liaison with the relevant police department, assist us in getting an updated report so that we can be certain that we are not technical people. Even if we are to look at these vehicles, let's get a technical report to really confirm that these vehicles were meant for a particular purpose, but not deliveries. I think that one would assist you in clearing the arising concern. Yes?
Yes, Honorable Chair, they don't even need the IOV because it is coming to see the owner who donated these vehicles.
No.
They're
not only looking at the owner or donor.
Yeah.
We want to assess the vehicle is made for what?
For what?
On record, you are telling us
Yes.
it could not transport other medicine.
Yes.
So we want a technical report.
Okay. IOV, would IOV do that? Okay.
And you are
Yes.
saying, because I want to give to validate our instruction, you are saying all these 20 vehicles,
All the 20 vehicles
yes,
are donated by Gavi
That's
for the
one.
purpose of transporting vaccines.
and you are saying they are all designed for only vaccine transport.
Only that.
Okay.
Only
So police follow up that and give us your finding to the relevant police department.
It's okay, Chair.
And Chair,
Yes?
Chair, the other point I wanted to raise through you is to the law that establishes the national medical stores. Is it the 1993 Act or you have a new one?
It is the 1993 Act.
Chair, under the circumstances, I want to ask the director once again, through you, Chair. I proceed, Chair.
Yes, proceed.
Mr. Director, do you have a responsibility on the procurement of medicines for Uganda and ensuring that the medicines are appropriate, or you are a store for the Ministry of Health?
We procure, warehouse, and distribute medicines. So there are medicines we procure using the funds appropriated to us, but there are also medicines we warehouse or store which belong to other departments of government, and we are obliged to warehouse them.
Chair, through you, would I be right then to say, Mr. Director, that in the event of medicines that expired, procured by you as the entity, the financial loss occasioned on Uganda by that procurement is indeed financial loss caused by the national medical stores?
If they will have expired because of our negligence, yes.
I rest, Chair.
General Manager, you said you had followed up on by the Auditor General. Now I want to take you to section to page 19 of the audit report. The summary of audit findings from other audit engagements. Under the item 4, value for money audit, a follow-up audit on status implementation of Auditor General's recommendations for value for money audit on procurement, distribution of essential medicine and health supplies, because it equally relates to distribution of medicine, the supplies. Now, on paragraph F, the Auditor General made this finding that there are significant delays in delivery of essential medicine and responding to customer complaints and queries. The Auditor General further updates us that the noted average delays to deliver supplies ranged between 19 to 69 days. On the other hand, national medical stores delayed by an average of between 16 to 572 days. 572 days, which period is that? So meaning someone can order today and you deliver after 2 years. After 2 years. This is an observation by the Auditor General. Now, that it's between 16 to 572 days to respond to customer queries. Now, and that the unresolved complaints also increased by 208%, I think more than 100, while the partially resolved complaints more than doubled during the 3 years period, 2022, 2023 to 2024, 2025, covered by the audit follow-up audit. Now, explain to us. You are saying that you are only delayed by vehicles and requisitions, that there is no requisition. The Auditor General is telling us that even with pending requisition, it will take you 3 years to deliver medicine to a hospital in Uganda. Which means of transport and what occasions such delays? Speak to this.
Yes, I'm actually speaking to that. And I want to make a distinction between delayed deliveries and delay to respond to queries. These are two different things. The first one was on delayed deliveries. Yes. That is taking the actual medicines. So where you were saying sometimes you delay by up to 69 days. Yes. But the other one of queries are people are asking for something from NMS, either an explanation or anything else. It may not, actually most of them are not related to actual supplies that you are delivering. But because they are stakeholders, they are asking questions, they want explanations over certain things. Some of them may also be related to the deliveries. I asked for 10 items, you gave me 8, or I asked for 8, you delivered 10, something like that. So those are the queries that he was talking about, which may take that long.
Now, you know, this speaks also delivery.
Exactly.
We are now interrogating an observation that when orders are received, you have accounted for the delays in your own explanation. But the Auditor General is telling us that even as we speak today, when you look at the period of delay, it speaks to failure to deliver on time. And even if these were customers' concerns and complaints, why would they double to more than 100%? Why would queries exist for more than 100%? These are medical issues. These are medical concerns. They will be attended to as a matter of urgency. Why should they? Because we are seeing them doubling, meaning that if I consult National Medical Store today, I will receive the answer. If I have a query, I will be responded to in more than 3 years ahead. Try to justify to us.
Chair, supplement. Supplement, Chair.
Oh, show us your current interventions.
Chair, thank you very much. Director General, or whatever the title is, General Manager, your core role in this Republic of Uganda is to store medicines, and they qualified it to say essential medicines. So we do not expect someone to ask you about Mabira Forest, for example, or sugarcane growing in Kachira or Lugazi. These are queries which are directly linked to your cardinal role. So if, for example, someone requested for 2 cartons of gloves, and then you delivered maybe 3 or 4, and then they ask why you under-delivered, and then you take 3 years to deliver, aren't you doing a disservice to the health of this nation? And what still boggles my mind is for you to tell us that we did not deliver because there were no requests, and you keep flipping your explanations. Today you say, okay, there were no supplies. The next explanation you say the vehicles weren't available. Can you please put us in order as far as
and I think it further buttresses the concern that if you cannot attend to this in a timely manner, how will you know and ensure that the medicine doesn't expire in your stores? It is actually delivered, because you take years responding to this. How can we tell what were the ingredients or the actual and exact concern within these unattended to queries and complaints.
Honorable Chair and honorable members, I would like to respond to this as follows. That the increase, when you increase your throughput or the deliveries, you also increase the number of possible misses, either over or under, or anything related to that activity. Meaning that if you had a budget, because all those 3 financial years that we are talking about, our budget more than tripled. So the more work you have, the more facilities you have, because almost every financial year, we have the number of facilities increasing or the upgrade. One which was a health center 2 is upgraded to health center 3, health center 3 to 4 to a general hospital. All these changes happen. And some of those things that we're talking about, as I had earlier indicated, they may not be related to the actual work of delivery of the medicines, but in general, they are talking about your mandate. So we discovered, and that is how we corrected them to make sure that we reduce on the way we respond to these facilities. Many of these facilities were sending us their queries, their concern using hard copy. For you to trace a hard copy, somebody has, a health facility has sent it to the district, by the time it reaches NMS, it has taken forever. So one of the things, because Honorable Chair, you asked us to give you the things that we have been doing moving forward. We have now automated our system, that if you bring a query to us that has not been logged into the IT system, do not expect a response from us, because we have extended this system to every health facility that we serve. If you bring a hard copy and it is misplaced, we have a challenge following up on your issue. But we also discovered, which was even a bigger issue, that the people who were raising complaints were not the people who are known or authorized to raise complaints within a given health facility. Because every health facility has an in-charge, has a person that we are responsible to. So if you have a nurse in a health facility raising a complaint to us tomorrow, and what they're asking is, NMS has not delivered medicines to us for the past 2 months. And you just go to the in-charge of the health facility or the store, we send our teams, only to find that these medicines were duly received within the record time. But somebody has lodged who is not authorized. So we have, first of all, decided and communicated that we will deal with specific people within a health facility, just because we want to be organized. Number 2, we have also trained those people and asked them to lodge their complaints within our IT system, so that when you have logged in the complaint, it is recorded and you can even follow the way it is being managed until when it is concluded. Honorable Chair,
But on that,
yes,
I don't think NMS should be so rigid, because these are medical supplies. I think you're also aware that some medication supplied actually gets lost or it's sometimes stolen. We have seen clips of recovered medicine meant for government of Uganda in private and other pharmacies. Now, for you as National Medical Store, if the medical director of a facility under whose control and direction the medicine was stolen and got lost wants to insist that there is medicine, but a clinical worker, a nurse, has notified you that actually we have no medicine to look after patients, and you are saying for you will wait until the medical director reports to you, these are issues which require investigation. If you receive such a complaint, you would also notify other user departments to investigate quickly, because you are alive to the fact that in Uganda, some of this medication actually disappear. But it should not be at the expense of the patients. And now that you have medicine in store, why should medicine get spoiled in stores when you can bail out innocent Ugandans? I believe a call and an alert from a nurse or a clinical worker is very, 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 very vital. And even if it was from a patient, now that cannot justify your delay to respond to them. Now to double to almost 20%, more than 100%. this is just a plea that you don't need to be so rigid in responding to some of these alerts. Needless to say that you must also show cause why you should delay anyway to respond to them.
Honorable Chair, it is not that we are rigid. What we are trying to do is that there should be a record of our interface with a given health facility. For example, there may be one issue that probably has been discussed, maybe by management or staff of one facility, but you get 3 or 4 queries about the same thing from the same facility. So for you, for
example, if you supply the medicine to a particular hospital X, expect that maybe the drugs will cover for 1 month. Once you receive an alert that there is no medicine actually, you rather notify the user departments. If you think medicine was supposed to cover a particular period, at least notify other user departments, like even the police, that how come that the medicine supplied, according to the reports we have, is not there. Meaning that when you keep silent, first of all, you are abating the theft because you supplied the medicine. You are abating the disappearance of the medicine. But again, you are acting in detriment to the innocent patients, the innocent Ugandans who would seek services. And I believe a concern and a call from a nurse or a clinical officer, more so and well knowing that you are going to supply the medical facility, is an alert. If you believe you supplied enough, notify the other user department, let there be an investigation so that the patients don't suffer at the detriment of both the medical facility and also now the National Medical Store, which has the medicine in its stores.
It actually makes us look bad if indeed, as you have said, there is medicine which has been diverted, has gone missing from the health facility. So what we always insist on doing is we respond to the issues that have been formally brought to us. That is what we are saying. Because if you, with the number, we have more than 3,500 now, more than that, individual health facilities, and you are there to respond. This person is asking you this question, you have responded to it. Tomorrow they are asking you the same question, you are telling them, please get in touch with this person, he has the answer, we responded to them. But in your system, it is like you have not responded. That is why now we have automated the system. We have made sure that every complaint that we get from our clients, which are the individual health facilities, are logged in a system that can be looked through and verified.
Because you as the supplier,
yes,
the stores and supplier, you are better positioned to assist in the safety of these medical supplies. Because once you are notified that the medicine is not, a medical facility A lacks medicine, but in your record, you have just supplied it. You notify maybe police, the Ministry of Health, other user departments. So that investigation are done, other than letting the public to suffer, seated comfortably, just because you have just supplied. But, Honorable.
Thank you very much, Honorable Chair. For records, I'm called Logose Sarah Annette, woman member of Parliament, Butaleja District. Through you, Honorable Chair, the Managing Director, he's the Managing Director?
Manager or Accounting Officer?
He's the Accounting Officer, the General Manager, okay. He has said that they have automated the system. My concern is, in comparison with the past and with the digitalized system, what is the response so far? What you have noted as National Medical Stores? Because if we are facing the same alarm, the same encumbrances, which means there is something that has to be done. So for me, it is my plea to you, just in case we are still facing the same challenges, then we must devise means, because not all the time that government will be losing money buying medicine, and after the procurement of the medicines, medicines get expired without being used. Yet people are crying down there in hospitals. Thank you very much.
Yes, Honorable.
Thank you, Chair. You see, in law, even an admission can mitigate your sentence. The MD has labored to explain that they are doing well. Yet the report of the Auditor General shows lots of lacunas. You as the MD, are you satisfied with the way you are operating vis-a-vis the cries or outcries of the public from the so many health centers and the public? Secondly, you have digitalized the responses or the question and answer sessions. Do you think that is satisfactory? Earlier on, you alluded to the fact that you are understaffed. Why don't you say, okay, this is a good advice? Probably you create a department fully fledged for question and answer sessions to respond to people's concerns. Because your delay as NMS, either to deliver or to do whatever you are obliged to do by law, costs someone's life somewhere. So these are observations by the Auditor General, because I understand before they came up with this report, they interfaced with you. I suppose you gave them this very explanation, but they said, no, we are dissatisfied and this is what we have observed. So why don't you work into mechanisms of reducing, for example, the delay from 2 days to a shorter period, so that you save someone's life somewhere? Because we are not here to
summarize, Honorable.
Much obliged to you. Let me leave it at that.
Thank you. I'm allowing only 2, then we get a response. We handle the financials. We have to conclude. Yes, Honorable. And then followed by you.
Thank you, Mr. Chair. I want to bring to the attention of this committee and our witnesses that our work as this committee, COSASE, it's to give treatment. The Auditor General does diagnosis. Ours to give what? Treatment. Then we are not here to win the argument, but we are here to give us explanation to this committee. I need an explanation. Since we say that donors have donated over 7.15 billion, what explanation did you give to such donors? Are we not threatening them to do more donations? What explanation did you give? Then, I heard you right talking about the IT system. What IT system do you use for first expiry, first out mechanism of drugs?
Thank you.
If it's working, why did it fail to prevent the loss of 8 billion shillings?
Thank you. Honorable, you're the last. No, there was a hand. Was it from?
Accounting officer, I want to know what measures have you put in place to ensure that these drugs will not expire again in your stores? Only that.
Thank you. Respond to those, then we handle financials and conclude.
And I hope you find it satisfactory. The issue on the delays of responding, because what we are now responding to are the issues that were pertaining in 2004-2005 financial year. I believe that when the Auditor General comes back, he will find an improvement, because these are the things he will find. This IT system has improved the way we do things so very much. And I'm very comfortable, I'm very sure that the report, because he has to follow up on these recommendations that he made to us, he will not bring a number of delays that is this high. Why? Because now we are implementing an IT system. We have agreed on the points people, and we are sure that when he comes back, he will find something different. And we are happy because we get a feedback from the health facilities that now we are able to do things faster. You've clearly, as chairman, had put it at the very beginning on the delays that were seen in that financial year, that the financial year ended and we hadn't delivered to certain facilities. And we have put it here on record that when the Auditor General comes to us, he will, and is auditing last financial year, he will find that all the facilities that we are supposed to deliver to were delivered to. It is progress. We are making progress. So on the donor, the honorable member was asking about the donor, whether they will be uncomfortable and they will stop donating. They are the ones, actually it is us who think they are the cause of our problem, of even these 7 billion of expiry. If they were coordinating with us better, the expiries will be there because they must be there, but they would be much less than they actually are. Because we have put it to them on the things that they need to do. One of them, which we discussed with the donors and we have discussed with our mother ministry, is to see to it that when these protocols change, when WHO, for example, says that the treatment now, first-time treatment for HIV has moved from this to this, as a poor country, we should not rush to change the treatment because these treatments change very fast in the economies that are doing well. Most of these things are around economics. They may not even be grounded in a lot of science, but I want to leave it at that. What we know is that, and we have asked the Minister of Health to help us doing, is that when the international community says this regimen or the types of treatments have changed, let us first use the ones that are already in the country, so that when we change the new treatment, it is not just throwing away what we already have, because when we throw it away, it will be seen as an expiry. And then we will be before this committee and other people, and they will not understand. For example, somebody now who needs malaria treatment, who needs an injection, and he hears what we are saying, may think that actually what expired is the injection that they need, not knowing that it is the medicine of ARVs or maybe TB medicines, which was not required, that was discarded. So we want to put this one into context. So, Honorable Bemba, the donors are very happy with us because when they compare Uganda with other countries, we are very far ahead of very many countries on the continent of Africa, probably one of the best on the continent in terms of containing expiries of medicines that they donate to us, and even the ones that we get on government of Uganda. So we are not here to win contests. We are giving explanations, genuine explanations. For the people who are out there, who benefit from the health facilities, they need to know, they need to get the comfort that NMS has them on mind, and everything that we do, if it does not make medicines more available to them, it is a disservice to us. Because when Parliament gives us more money, but it is not reflected in the more services to the wananchi down there, people think NMS has not delivered the medicines when something has happened after the medicines have been delivered. NMS is not in charge of the stores of the health facilities. We have also urged our stakeholders and the counterparts, in the police, in the IGG, in other people, why don't we also, the wananchi themselves, because they are the ones who benefit and they are the ones who see how these medicines are taken out of the health facilities. What we only do, as requested by members of Parliament some time back, can you innovate? Because we were not here. Now, members of Parliament confirm that they get messages whenever we deliver to your constituencies. That was not the case before. We used to deliver and we would come here and the members of Parliament would say, for the past 8 months you have not delivered. But we know that the previous week or month we delivered. And then we decided that let us have an IT tool. This DMT, the delivery monitoring tool, against which we deliver to you. This is an innovation within NMS. You will go anywhere on this continent, you will not get it. When you are talking with people, they even think we are living in another world. But of course, when we come here, people are saying you need to do more. And we will commit to do more every time we get feedback from you, we get feedback from other stakeholders, we keep improving, innovating to make sure that we better our delivery of service to the people that we serve.
Chair, on the financials, I have one query to the General Manager. I noted on the issue of contingent liabilities, and this from the introductions, I didn't hear any person from the legal department. Maybe HR would handle. Oh, legal is here. We seem to be having a number of pending court cases ongoing, and some of them relate to labor-related claims. Is this something that is inherent, that could be recurring regarding is there anything in your, because, you know, if we have people going out and disputing, we don't want to hear that one of the people who has escorted you is in court now when we're discussing the next financial report. So my direct question is there any inherent issue that makes these cases that many? Because I think about, when I read, about 4 or 5 of them out of the 11, which is over about 40% of the cases in court are labor related. And then there are also I think 3 are land related. Of course, that maybe could be relating to the nature of issues in the land in civil cases. But my concern was regarding the issues of the labor-related claims. Thank you.
Yes.
Thank you very much.
Elaborate.
Thank you very much.
Why do you have so many labor disputes? Are you managing National Medical Store properly in accordance with the Employment Act, or there's a witch hunt? Why are there so many cases, and do you receive a legal opinion over labor matters?
Yes, thank you, Chair. We actually have a secretary to the board who also helps us as the corporation secretary, so he will also buttress this point. But what I would like to tell this committee is that we believe that we are managing our issues with our staff very well. A number of entities, I believe, would have more, but the ones that you see here are the ones that have been in court for a long time. I think they are coming to around 15, 16 years now. They've been there, and they were related. They were not on our own making. If we had a way of dealing with them directly, then we would probably have handled them differently. There are issues which came from the Office of Auditor General. Office of Auditor General came and audited NMS then, many years ago, and there were staff who, according to the Auditor General, they thought that they had been involved in mismanaging of the medicines within the stores, and they recommended that those people be dismissed. All the arguments that we had on the board and other members that these people could be terminated fell on deaf ears, because we thought that we could terminate them and have it better. Yes, a number of them probably would have gone to court, maybe few of them, not as many as went to court, because the entire group that was dismissed went to court, and we have been in court all this time. We have no control over how the issues are resolved in court, but they are the issues that we did not initiate. But for the other cases, the other labor disputes which are there, they are still normal. We believe that we have gone through the process so well. We have given them the hearing, and for those that still were dissatisfied and they went to court, a number of them, if not all of them, have been disappointed because we won the cases. Some of them have decided to appeal to higher courts, but in the labor courts, we've won those court cases. And others who had taken us on other reasons where they feel they were unfairly treated, We have also gone to some of those bodies to ask them to dismiss some of those cases because they lodged them there and they have not gone back for the past, I think, about 10 years. And but then because it is not court where you directly go to, they were, I think, in some commission, either human rights or somewhere. So their processes are different. So we have engaged our lawyers to go and talk to those people to see, because if a case is there for 10 years and somebody who lodged there has never gone back, and every time you are there and you don't know what is happening. Honorable Vice Chair, we believe that NMS has handled this, considering the number of people that we have and the work that we do. If it was not for that very old case, probably we would have like 1 or 2 cases still here. But we believe that with time, the courts should be able to resolve this issue one way or the other.
Thank you, but take it as advice. When you take a proper scrutiny of these cases, maybe contrary to your submission, the details of the case and financial implication of those I've seen here in these annexures are to the effect that the relevant employees won in the High Court, and largely it is you on appeal. I don't know how you quantified the numbering, but from the details here, there are several instances where these employees were awarded damages, and you have appealed. But I won't preempt matters in court. All what we want to establish is whether, while you are employing and managing staff, you have proper manuals on staff employment and proper contracts. So, in the circumstances, we need copies of employee agreements or contracts, and generally, I want to ascertain that you actually follow the employment law, because now it speaks to financial implications. You need to avail the committee with a copy, and there would be manual you follow while employing and disappointing staff. What are the modalities? Want to ascertain if they are in tandem with the law. Otherwise, if not redressed, these cases may be on the rise. And needless to say, at one stage, any of you can be the victim. So we want to protect all of you in circumstances that there is a termination, that the law is folded to the latter internally before you resort to external arbitration. Honorable Bruce?
That in case of, if there is something inherent, we didn't want to come back here after 2 years and we have one of the cases is Moses Kamabare versus NMS.
Mr. Chairman, I request the accounting office and the finance manager to open page 10
of what?
With the financial report. There's financial statements. That is why there's a cash flow statement. They are there? Okay, first of all, when you look at the net cash flow from operating activities, it has been negative between last year and now. As an accounting officer, does it concern you that you are leading an organization that is consistently posting negative cash flows? Meaning, even if you went to a reasonable bank, they cannot give you any credit. Your cash flow from operation is growing from 515 to 580 in the new year, in the year under audit. Now, that is not even the main issue. On the same page, look at note 19. Note 19, where we have non-viable stock write-off. In 2025, you have 532 million, and then in 2024, you have 316 billion. Now, this is coming from note 19. Now, let's check note 19. Note 19 is on page 21. on page 21, where there is non-viable stock. For 2024, the figure you transferred to the cash flow is 316. It is the one that you moved to the cash flow. Isn't it finance? Have you seen it? Then for 2025, the figure you transferred is 532. And yet the same total down is 8 billion and 40. So why is it that when you came to 2025, you left out the 7.5, but when it was 2024, you included the 315. Why is there inconsistency in this presentation? Thank you.
Head Finance.
Yes, accounting officer.
Yes,
And
I'm
you can-
asking Head Finance. She
Yes,
has the
Head
explanation.
I have noted that, and I remember, if I can cross-check, if I just look at the figures carefully, but the difference must have been treated under the inventory for purposes of the partner items. This year, what we had chosen to do was to disclose the actual that is written off out of Government of Uganda procurement, and the other one, I will cross-check shortly, must have been accounted for through the movement in the inventory.
But you know, one of the accounting principles is consistency. What you apply in 1 year is because it has an impact on operating balance.
Thank you, colleagues. Colleagues, I thank you for today's engagement. I have to end this meeting here. For the National Medical Store, please deliver the documents, and as well, we shall notify you as and when we need you back. The police CID is going to assist us also verify those vehicles, the vehicles, and for now, we'll first concentrate on preparing all those accompanying documentation, and you are available to the committee. Our next meeting will be on 10th, on Monday, 10th August. Meeting adjourned.